Okay, I'm going to get right to it. What is the current status of Hoag Hospital in Newport Beach as far as the pandemic is concerned? And to understand that, you have to understand what crisis standards are. Now, I'm a cosmetic eyelid surgery specialist. Why am I sending out this information? Basically, as a service to my family of patients and to gather the facts needed to help me make an informed decision on opening my practice for cosmetic procedures, which I haven't done yet. Let's try and make sense out of these recent news reports. Like the WHO is warning that the worst is yet to come, and Los Angeles may run out of hospital and ICU beds in July. These next few slides are a definition of crisis standards that was taken off a TV transcript that I saw the other day. Will Humble is the Arizona Public Health Association Executive Director, and he was formerly the Director of the Arizona Department of Health Sciences. Now, crisis standards are protocols that give guidance for doctors on how to ration care when there's inadequate resources to treat everybody. It's actually a scoring system. It's based on how acute it is, how risky it is, and that a person's going to end up with multi-organ failure, how old the patient is, if they recover from COVID, how many years or months would they likely have left. You combine all these factors and decide who gets what, who gets care and who doesn't get care. For example, if you would have gone to an emergency room under normal circumstances, they might say, let's send you upstairs to an inpatient bed and watch you for a couple days so you can get better care. When you're in crisis standards of care, you just may be sent home from the ER when you normally would have had a bed. In the same way, if you're in a hospital bed already, under normal circumstances, if you start to deteriorate, you might get an intensive care bed because you kind of need that kind of care. But when you're in crisis standards of care, you triage who gets that ICU bed. So you may end up staying on the regular hospital floor when normally you would have gotten more intensive care. Now, it's important to understand that the standard of care changes when you get into surge status. When we're talking about using daily hospital capacity, when you look on the website and see what the capacity is and you see how many beds are left and everything like that, as an endpoint for how we're going to manage this epidemic, we have to realize that changes are happening right now in the hospital that affect us all because of these new standards. We are rationing, we're starting to look and see what things we have available to us. So we have to act now to prevent that from happening and to control the virus spread. Now, we talked a little bit about crisis standards. Let's talk about Hoag Hospital itself. Now, the following slides are based on very detailed notes and transcriptions that I took from a Hoag telephone conference that was to update medical staff and employees just 2 days ago, July 1st. And it features a summary of comments from Michael Hurwitz, who's the chief of the medical staff, Phil Robinson, director of infection prevention, Melissa Garcia, manager of infection prevention, and Grace Levinsky, who's in charge of surge planning. This was a fantastic meeting. It was very well organized, just the facts, no editorializing. And that's what we're going to go over now. They have found that there's an increasing number of cases that are directly related to socializing outside of normal circles. Particularly bars and restaurants are clear risk factors for the transmission of the virus. Now, surgical volumes are approaching 100% capacity. So far, we've been able to take care of everybody needing surgery. So far, we have adequate capacity. Let's talk about the statistics. How has Hoag been impacted? Well, all told, they have seen 467 patients who have tested positive that have been seen. Of those, 228 had to be admitted. 407 of the total fully recovered. So many are still admitted to the hospital. As of July 1st, Hoag Newport had 34 COVID cases total, 3 of which were in the ICU. At Hoag Irvine, 11 cases total, and 4 were in the ICU. Now, this is what I found most important. Other hospitals in Orange County are at or near capacity, including St. Jude's, St. Joe's, and UCI Medical Center. So the fact that we might have capacity and we're still managing to hang on, we have to think about what might be happening tomorrow. And if you look at the graphs, you don't need to be a rocket scientist or a doctor to figure out what may be happening. Okay, let's talk about And I'm stressing these things because I want to stress at the end how important it is to social distance and do masking and everything we can to prevent an overwhelming of our medical system. These are new clinical symptoms. There are 4 new symptoms that have been added to the list: nausea, vomiting, diarrhea, and headache. They've found that there is significant pre-symptomatic spread, that's asymptomatic patients. Up to a third of the patients transmitting this disease may have no symptoms at all. That's why we have to assume that everybody has the disease. In addition to that, there are new risk factors of asthma and pregnancy, in addition to diabetes and hypertension and the other things that are well known. Let's talk about therapeutic options at Hoag. Number 1 is remdesivir, and we were lucky in having one of the highest enrollment sites in the Gilead clinical trial. It's been proven to decrease the length of recovery by 31%, and there's also a trend, although not yet proven, toward decreased mortality. Now, demand for this drug is now outstripping supply. It's a critically low resource. And Hoag has started using ethical framework, which are crisis standards, to decide who gets what drug. These are difficult decisions for doctors and hospitals to make, but we have to make them because we're in that situation right now. There are some clinical trials that are starting. They have to do with drugs that are reducing inflammatory component. Excuse me. The second thing that we have as a main therapeutic option are steroids. According to the CDC recommendations, dexamethasone for 10 days is now given to any COVID patient needing supplementary oxygen. It has been shown to decrease duration and mortality. Other than that, I think we're kind of have supportive care for any other conditions that come up, but those are the 2 main things, remdesivir and steroids right now. Now, let's talk about testing and resources. Testing is very limited, especially because Hoag uses the best test having the highest sensitivity and specificity. They're in demand, and I would imagine, with what's happening in other states and around Orange County, they're going to become less available. So we are not testing asymptomatic patients now. And the recommendation is not to test asymptomatic patients. There's a low yield, and it doesn't really change our management. So if you're kind of curious, if you have it, now is not the time to run in and get a test, and certainly not to the emergency room. We'll get that later. So right now we're testing only patients with symptoms to preserve the testing materials that we have. Yes, we can currently test asymptomatic surgical patients for other reasons like heart problems or tumor removal and things like that. Let's talk about coming back to work after having COVID. At the hospital, they used to require 2 negative tests, but no longer because it utilizes testing material that should be used for others. We've also learned that patients can still test positive through that PCR nasal swab for many weeks and even months. And what we understand about the transmissibility of this virus is that we've not been able to cultivate any live transmissible virus from any patient with COVID after the 8th day from the onset of their illness. So, for now, Hoag's adopting the CDC recommendation that any patients with COVID can be removed from isolation 10 days after the onset of their illness, providing there's no fever during the last 3 days when they're off all fever-reducing medications and everything. So, how about employees? Well, basically, employees are urged not to come in if they're sick, obviously, and they need to stay home for 10 days if they have any symptoms. Now, the variety of symptoms you can get from this are so vast now that pretty much if you don't feel sick in any way, it's usually covered by the kind of things. It could be COVID, and if you're strict about this, you should stay home for 10 days and see what happens. That includes fever, sore throat, cough, chills, fatigue, muscle aches, headache, and the new ones are diarrhea, nausea, and vomiting. So don't come to work if you have these symptoms, and if you test positive, family members should quarantine for 14 days. Let's talk about masks for a second. It's very important that masks have to cover the mouth and nose completely. I see a lot of people walking around with, when they are wearing masks, sometimes pulled down a little bit or around their neck, or they have it in their pocket. That doesn't cut it, and it doesn't do anything. And remember that the outside of the mask is contaminated. Now, there's something new that I learned. Actually, I've learned a lot of new things. But one very interesting thing was that you can save N95 masks and they could be recycled with a cleared FDA process. That's encouraging on the one hand, that we utilize masks and not have waste. On the other hand, it points to the coming shortages of masks and supplies. And I can speak to that directly because I've been looking to purchase masks and get my office ready to go. There are recycle bins at the hospital for masks. Contingency plans at the hospital are ready to deploy. There's a 2-month supply of critical medications for Newport and Irvine. There are ample ventilators and ability to upgrade to high-flow oxygen devices, I think something like CPAP machines and things like that. There's contingency plans for staffing additional doctors, nurses, and respiratory therapists. And even the infrastructure of the IT department has been strengthened. Now, in Dr. Hurwitz's closing remarks were very important, and I took to heart. And that's one of the reasons that I'm giving this presentation, because I wanted to spread this information. We need to protect our resources, both our human resources and supply resources. Don't go to the ER to be tested. Go to urgent care instead, because that's where they're doing the test. We don't want to overrun the emergency room. Talk to our kids. It's hard for them to understand the importance of wearing masks and social distancing, especially in the summer when it looks so nice outside. And understand that a lot of people spread this without having any symptoms at all and feeling great. And kids are less likely to understand that. So they really do need to understand why they need to keep away from other kids and wear masks. There's also going to be extremely limited visiting hours or visiting in the hospital at all. Now, as far as surgeries go, for now, elective procedures are continuing, but there's no promise of that going forward. Things are changing rapidly, and the county or the state could stop all elective procedures at any time. So Dr. Hurwitz's last thought was, as our responsibility as healthcare experts is to get the facts out, dispel rumors, and don't take any unnecessary risks. So what are we worried about? We're worried about getting sick ourselves, getting other people sick, and understand there's a significant incidence of asymptomatic carriers, and assume that everyone may be an asymptomatic carrier, and share this presentation with a non-mask wearing friend and let them make their own conclusions. In other words, people are entitled to draw whatever the conclusions they want from the information available to them. But these are totally the facts. These are happening now in Orange County at our hospital. And I think that if people who aren't wearing masks now knew what was happening and where we might be headed, they might come to their own conclusions and start being safe for all of us. So thank you for listening. Stay safe, wear a mask, and social distance.